I'm Martin McCabe. I'm a paediatric and adolescent oncologist. I'm based at the University of Manchester and the Christie Hospital, and I am leading the BRAINatomy project with Professor Tom Merchant at St Jude Children's Research Hospital. The project is a research study generously funded by Stand Up to Cancer and Cancer Research UK as part of the Paediatric Cancer New Discoveries Challenge. And the aim of our research is to identify the brain regions that are responsible for damage, both damage to learning and also hormone damage or endocrine damage in a large group of children who've been treated with radiotherapy to the brain. We look at how brain radiotherapy affects hormones, intellect and behavior, in addition using a young animal model, so studying young rats, and compare the effects of radiotherapy with conventional X-ray radiotherapy and proton beam therapy, which is a newer way of protecting parts of the brain. We're achieving this through several work packages, and some of our team members are here today to talk you through our work. So the two work packages that I'm particularly involved in are work package 1, which is the overall steering group, which is there really to keep an eye on how the overall research is going, and work package 2, which is about data collection. So we've collected data from children from several clinical trials carried out at St Jude Children's Research Hospital, and also from patients treated in Manchester at the Christie Hospital and the Royal Manchester Children's Hospital. And we're looking at data that includes the children's diagnosis, their surgery, their medical therapy and radiotherapy treatments, and looking at what damage they had when they were first diagnosed, anything that happened after surgery, and then particularly after radiotherapy. Looking at the effects on behavior and intelligence and on the endocrine system. And the data we collect are then used in the other work packages by the researchers who are trying to piece this all together and look at the effect of radiotherapy, but also the effects of the various other injuries that children have during their treatment.
My name's Simon Dockrell. I'm a neurosurgeon and PhD student at the University of Manchester. One of the main aims of the BRAINatomy project is to identify structures that are sensitive to radiation in the treatment in children with brain tumours that are likely to affect their future cognition and hormone function. And so my work package is actually focused on trying to identify damage to brain structures when the child presents with the brain tumour and after they've been treated with surgery based on their brain scans. And this is all performed prior to them having the radiotherapy. So this is important because without this, it'll be difficult for us to know whether or not the problems identified are caused by the radiotherapy or the actual tumour itself and the treatment, such as surgery, to try and remove that tumour.
So my name's Abby and I'm a postdoctoral researcher at the University of Manchester, and I'm a physicist by background. So I work on work package 4, which is looking at how we can use the imaging data and radiotherapy data that's been routinely collected during the children's treatment to see if we can find links between how the radiation dose specifically to different areas of the brain is linked to problems later in life with hormone production and cognitive functioning. We look at the images and maps of radiation dose that were delivered as part of radiotherapy treatment from many individual patients who were treated at St Jude's or at the Christie. And we use this to look at links between the dose, the radiotherapy dose in all over the brain, and link this to whether there's regions that are most sensitive to that radiation and linked to the side effects that we're looking at for hormone and cognitive function.
So my name is Lydia Wilson. I'm a medical physicist at St Jude Children's Research Hospital, and I'm involved in work package 4 along with Abby. And the way that I see that work package contributing to the overall BRAINatomy project is as Abby explained, we are looking for correlations between the patient's radiation treatment and outcomes as measured by their cognitive function as well as endocrine outcomes. And so that then can inform the other work packages. For instance, the work package is looking at animal models. It can inform where they need to be looking for parts of the brain that might be impacting cognition if we find that radiation dose is associated with it. And it can also take information from the other work packages and see if we find the same correlations in humans as we saw in other areas of the project. So it's really well integrated with everything else that's going on in the project.
We know that children and young people with brain tumours, particularly when they have radiotherapy, are damaged by treatment. Not all patients are, but a lot of patients are, particularly young children. We also know that certain parts of the brain are linked with certain functions like vision, hearing, memory. But importantly, all those different parts of the brain all link up and talk to each other. And when we're giving radiotherapy to children, we concentrate almost exclusively on making sure that the tumour gets the right dose, rather than on protecting parts of the brain that aren't affected by tumour, partly because we don't really understand which of the brain regions we should avoid, even if we could avoid them. We will identify brain regions that are particularly sensitive to radiotherapy, so that in future we can either design treatments that avoid those areas, or if it's not possible to avoid them, through the animal work package, we hope we'll get some clues about treatments that we might be able to give to children to protect their brain when we know we have to irradiate those sensitive parts.
Our hope with this project is to improve our understanding of some of the risk factors for cognitive impairment and reduced hormone functioning for children who've been treated for brain tumours. And one of the reasons this is really so important is because over time, we now have got to a point where many children who are treated for brain tumours are now surviving the long term. However, because of problems potentially caused by the tumour and their treatment for the tumour, they can be left with problems with their kind of cognition and their hormone functioning, which can lead to needing lifelong replacement of their hormones. We also find that among long-term survivors, unfortunately, they tend to have reduced educational achievement, salaries, and employment rates compared to other siblings and peers. So if we're able to improve our understanding and find ways that we can alter their treatment where they still have the same survival, but they have reduced kind of long-term effects that might affect their cognition and their hormone function, then we could potentially really improve their future quality of life, which is very important.
Yes, the way that I see our work package impacting the wider research landscape looking forward is that technologies are advancing really rapidly. And even in just the past decade, we've gotten much better at being able to precisely shape the radiation dose to a very well-defined volume in a patient. And in order to maximally beneficially take advantage of that, we need to know not only which regions we want to leave that radiation in, but also which regions we want to avoid. And so our research is going to inform future research to design new treatments that take advantage of this knowledge and keep the same benefit of the treatment with the radiation dose in the tumor, while improving the safety of it by avoiding those particularly sensitive structures that we can identify. We also still have a lot more technological advancement that can be done, and we don't even know what new technologies we need until we understand what would most maximally benefit the patients to help guide that technological development.
One of the things that's really exciting about the methods in our work package for using image-based data mining is that it's quite a new and really powerful tool for us to be able to analyze data that has been collected from patients routinely, so it's not coming back prospectively for more tests and more follow-ups. We're able to use this tool to learn from the data that we already have and use it to inform our future treatments to benefit patients in the future. So I think it's really like using technology to our advantage to be able to learn from the kind of amount of data that is routinely collected from patients that are coming for their radiotherapy treatment.
Being a part of this project means literally everything to me, both professionally and personally. So professionally speaking, I've been interested in pediatric radiation therapy for about 10 years now, since I was in grad school. And obviously working at St. Jude, that is all we do. And in particular, I've always been driven to study the long-term effects of our radiation treatments and how we can improve, not only give these patients long-term survival, but improve their quality of life looking forward. A big challenge in doing that with pediatric radiation therapy is that pediatric cancer is a rare disease. And in order to study these things that are in a rare disease and also thankfully relatively rare effects, we end up with very small numbers of patients to study. And so this work is really only possible by very large and strong collaborations. And this is the first and the most fruitful one that I've ever been a part of. So this has been the culmination of a 10-year-long dream for me that I'm finally able to participate in and make real progress towards something that I think is incredibly important for some of our most vulnerable members of society.
As a physicist, I find it incredibly rewarding to be able to use my skills to contribute to improving the lives of children that have been treated for cancer. And I think it's I think this project has been particularly rewarding for me because of the breadth of the long-term effects that these children can have after their treatment. There's so much work to be done. So for me, I find it really rewarding to be working and contributing towards this and making progress to improve treatments for future children. And kind of similar to what Lydia has said as well, I found this collaboration between our 3 different centres and within this very multidisciplinary team where we have physicists, we have neurosurgeons, we have medical oncologists, and it's been an incredible experience to be able to work together towards this common goal and seeing how all of our expertise ties in together to be able to reach the aims of this project. I've just found that really rewarding.
With this project, once we are able to start to identify what some of the different risk factors for causing problems with future cognition and hormone function are, the next step would be for us to start to try and put these risk factors together and start to produce what we call a prediction model that allows us to predict whether or not children are likely to have cognitive problems and hormone problems. And the idea of this is this will produce a tool that our clinicians can use when they're starting to make decisions so that they can try and maximize a child's survival, but also optimize their outcomes in terms of cognition and hormone functioning. And if we're unable to reduce the risks of some of these problems, then at the very least we can start to identify these children earlier and start to give them a more kind of tailored treatment and support in the future.
As a pediatric oncologist, I actually look after young adults now, but I see both children who are going through treatment and also see the patients in long-term late effects clinic. And sometimes that's 40 or 50 years after they finish treatment. So I'm really painfully aware of the damage that children experience. A lot of it is due to radiotherapy, but certainly not all of it is. And that's, of course, why the work package that Simon's working on is so important. It's easy to feel quite powerless when you see patients who are very damaged by their brain tumours, and particularly by the by the damage that we have inflicted in the process of curing them. Because often there isn't a great deal that I feel we can do other than support them in their disability. And of course, what we all want to do is to fundamentally change how we treat patients to avoid the damage in the first place. So this is a really exciting opportunity that we we have enough expertise in the group that we can start to work on that and really change the paradigms that we use. Collaborating with colleagues from different branches of medicine, science, engineering really brings different perspectives on how we should approach a clinical problem, and that in itself is very exciting as well. We're very fortunate that the funders of this work, Stand Up to Cancer and Cancer Research UK, are actively encouraging clinicians with clinical problems to work with colleagues from many different fields and to work on some of the most difficult challenges that we face, quite honestly. And I'm very fortunate in this project to work with a number of other professionals with real expertise in so many different fields of medicine and research, so clinical medicine, preclinical medicine, physics, all sorts of things. Collaborative research like this is not always easy, but it is almost always fun. It's a really enjoyable thing to do. And I'm very confident that what we do will result in changes. It might not change what we do in the short term, but in the long term, the knowledge that we gain will definitely have an impact on how we irradiate children, how we image children, and the sorts of things that we should be looking for in the short term and the long term during treatment. So to me, this is both a very exciting opportunity and a very enjoyable opportunity, but it's also an incredibly difficult but important thing for us to do.